Good morning. I am Dr. Ramsha, and we are going to be talking about the remaining corrosives that we left in the previous lecture last week. So, today is a very simple lecture. We just need to know about two things, one being the organic acids and the other one being the carbolic acids. Now, you might be thinking that why didn't we just discuss all of them back yesterday? Now, just a second. So, the main reason behind grouping these two things, organic acids and carbolic acids, differently was how they react in the body. They react a bit differently. Now, we are calling them corrosives, but they do not have a very, what should I say, an abundant corrosive reaction when they get in touch with the surface, like alkalis or the strong acids that we just talked about last week. Those alkalis and acids just had such an enormous reaction when they got in contact with the skin that they melted away the skin. They caused ulcerations and everything locally. They did not get a chance to give systemic effects because they were locally so much damaging that the patient just couldn't recover from the local damage. Now, in case with organic acids and carbolic acids, that's not the case. They are they can irritate the surface, but they will get absorbed and they will have remote systemic actions. Okay, so someone's saying something. I hope it's clear. जी
स्लाइड्स
जी
कुछ चेंज स्लाइड्स से चेंज नहीं
हाँ
हुई है।
स्लाइड मैंने चेंज करी नहीं है, अभी तो मैं सिर्फ इंट्रो दे रही थी।
अच्छा
हाँ, स्लाइड तो चेंज करी नहीं है। ओके, so these would be the objectives for today. It's just that by the end of this lecture, you'd be able to know about oxalic acid and carbolic acid. So now let's talk about organic acids first. So organic acids include a number of acids like oxalic acid, carbolic acid, acetic acid, salicylic acid. Now, all of these acids are grouped together because they have similar features. Okay, a poisoning case with oxalic acid and carbolic acid would give more or less very similar signs and symptoms. All right. Now, as I just previously mentioned, that they act strongly as local irritants. However, they produce a systemic action as well. All right, because they get absorbed in the system. So let's talk about oxalic acid for now. It is a corrosive. We all know that. The main thing that comes when we encounter a case with oxalic acid is that this substance resembles zinc sulfate and magnesium sulfate. Now, I know none of you would be knowing what's zinc sulfate or what's magnesium sulfate, but I guess you might be familiar with something called the milk of magnesia. It's like an antacid that's usually like it's an over-the-counter antacid, and it's like a white-colored liquid. Many households carry it, so probably you might have heard about it. So this oxalic acids resemble that. It's a thick, white, liquidy substance. Okay, so we need to differentiate between the three. All right, because if someone's coming in with a suspected case of oxalic acid poisoning, must be sure that it is oxalic acid and it's not something else like zinc sulfate or magnesium sulfate, right? So you can identify, let's suppose you found some milky white substance at a crime scene where there was attempted suicide, right? So you might think of that it's probably oxalic acid, but you need to make sure that it's not something else, which is not that harmful. So you can differentiate between oxalic acid and magnesium sulfate and zinc sulfate based on all of these characteristics. The first one being taste. Since it's an acid, it's going to be sour in taste, and whereas magnesium sulfate and zinc sulfate would be bitter. The reaction would be strongly acidic because it's a strong acid. When applied heat, it's going to sublime. When mixed with sodium carbonate, it's going to produce those effervescences, all right? Those bubbly texture, it's going to bubble basically. And how is it going to stain? What is it going to do with stains? It's going to have some bleaching properties to it, okay? And whereas for the rest of the things, there won't be any bleaching properties, okay? So the main sign that you need to look out for in case of oxalic acid is hypocalcemia. You can see how I just uh, boldly written hypocalcemia, because that is the only thing that you need to remember in case of an oxalic acid poisoning, right? Oxalic acid somehow loves calcium, all right? It's going to bind to all of the serum calcium that we have freely available. And what happens after that is you're going to see all of the signs of hypocalcemia. And don't forget renal damage and shock as well. It's going to produce shock, and it's going to produce renal damage because it's the oxalates that's being formed with calcium. They go to the kidneys to get filtered out, and they just damage and cause havoc in the kidneys, right? So let's talk about the remote action. Firstly, there can be shock that can lead to death. After absorption, the signs of collapse or shock soon appear. For local actions, it's going to have a sour taste in mouth. Obviously, there would be some burning. It has some corrosive properties, remember? So there would be some burning, there would be some sour taste. There can be vomiting because it has a locally irritant effect, all right? So any irritant, anything that you intake that has irritating properties, right? Most of the poisons have irritating properties in them. They're irritating the GI lining. What happens when the GI lining gets irritated? Rapid peristalsis in the reverse direction, causing vomiting. This is a protective mechanism of our body, basically, that whenever our body encounters with something bad, it just tries to get it out of the system, right? And one last thing that I want you to remember is that whenever, this is not just for oxalic acid, for any acid, when this acid comes in contact with blood, it's going to turn the blood to a black color. Why? We discussed it last week. Remember the hemoglobin part of our blood? When hemoglobin gets in contact with some acid, it oxidizes and forms hematine. Now, this hematine has a dark brown to black color, and that is why whenever the blood gets exposed to any strong pH of acidic content, it's going to turn black. Okay, are you guys with me so far? So, all right. Let's talk about the remote action, because the local action is not that significant. It's just some mild irritation, burning, vomiting, nausea, tingling sensation in the mouth. That's it. The main symptoms are the remote ones. Okay, what are we going to say in a patient with hypocalcemia? Now, can any one of you just type in the chat box? Don't read the slides. If you might know what is hypocalcemia, it's just low serum calcium. What happens when we have got low serum calcium? Come on. Any one of you? I've got some around 230 plus participants. Guys, anyone? You don't need to raise your hand, Osama. You can just type in the chat box. Okay, I don't know what to do when you've raised your hand. Just type in the chat box. What happens in the body when there's low serum calcium? Yes, Osama, you can say it. whatever you want to. Okay, so no one's interested, I guess. It's all right. Let me tell you. The only Osama, I'm really not sure how to what to do when someone raises their hand. Can you please type in the chat box, because I'm not sure what happens when you raise your hand. I'm sorry. Okay. So the only thing that I want you to remember for hypocalcemia is increased excitability of tissues. The calcium, there is a whole pathway involved. I'm not going to go in that detail, but basically calcium maintains the excitability of tissues. And when there's low serum calcium, the excitability of tissues increases to significant extent, all right? This is why we feel the numbness or tingling within the body, the mouth, the hands, feet. You're going to feel this numbing and tingling sensation. This is a sign for increased excitability, all right? Then comes spasmodic twitching. Twitching is basically involuntary muscle contraction that's happening at a specific interval, right? That's spasmodic. Why is this happening? Because the muscles are getting overexcited, right? Even with the slight stimuli, the muscles get so stimulated that they start twitching on their own, right? Same happens with face. Same that there would be facial twitching. And lastly, convulsions. What are convulsions? These are involuntary muscle movements across the body because of increased sensitivity to particular stimuli from brain. There's increased sensitivity because of low serum calcium, and that is why you can encounter convulsions. Can you just link the chains together now? The only thing that you want to remember is decreased sensitivity, and then you'll be able to tell me what would be the signs for hypocalcemia, right? Now, this is the classic carpopedal spasm that we see in cases of hypocalcemia, right? Now, this is a nice little summary that happens when we've got some low serum calcium. There would be tetanic spasms. The two signs are Schwestig signs and Trousseau signs. Schwestig sign is just when you tap on the cheek and there is facial twitching. Trousseau sign is when you take the blood pressure, and the increased pressure on arms causes carpopedal spasms in the hand. Other symptoms can be muscle pains, abdominal pain, perioral tingling, all right? So we talked about renal damage. Remember, for oxalic acid, there was hypercalcemia that I wanted you guys to remember, and then there was the renal damage. Why? Because oxalic acid is going to combine with serum calcium and form things that would damage the kidneys, all right? So it itself is nephrotoxic, oxalic acid. So what happens when the kidneys gets damaged? They're going to leak blood, they're going to leak albumin, and obviously those crystals that have been formed that are causing the renal damage, the calcium oxalate crystals. Okay, oxalate binds to calcium, forming those calcium oxalate crystals. They go to the kidney, they wreak havoc in the kidneys, they cause the kidneys to become leaky. The kidney is going to leak blood, albumin, and whatever it's having, right? Now, the urine that's coming out has calcium oxalate crystals in them, right? And this urine would be termed as oxaluria. The presence of calcium oxalate, all right? These calcium oxalate crystals are enveloped shaped. So let's suppose you come across an exam question that says that the patient has ingested some unknown poison, and upon examination of his urine, you can see some envelope-shaped crystals. What is the possible diagnosis? You can go for oxalic acid poisoning because calcium oxalate crystals are envelope shaped, right? Okay, so this is something that you don't need to remember. So that usually occurs within an hour, so it's quite fatal. Now for the treatment. Now since the corrosion is very mild, we can use a stomach tube. Remember for the strong acids and alkalis, how the stomach tube was contraindicated and we needed to use a very soft leave-iron tube in order to gently wash the stomach. Remember, here there's a very minimal risk of perforation because the degree of corrosion is not severe. So we can use a stomach tube and we can safely wash the stomach, right? Now, the main antidote for oxalic acid poisoning would be any calcium preparation. You know, oxalic acid loves to bind with calcium, right? So what we're going to do is we're going to provide them with calcium. Okay, most commonly chalk can be used. Okay, chalk is not used in hospitals. Remember that it's like an at-home treatment. In hospitals, we're going to be using calcium gluconate IV or by mouth. You need to monitor your urine out, the patient's urine output. Why? Because there's renal damage, and rest is symptomatic. So, post-mortem appearance. Um, can you just a moment, just a moment. Okay. So for postmortem appearance, remember it has some bleaching properties to it. So the mouth would appear white. All right. As per the stomach, it's going to have some gelatinous brown liquid. Why? Because of the local irritation, blood oozed out, and it formed hemetin, and that's why it's having that dark brown gelatinous liquid inside it. Mucous membrane would show signs of corrosion. Perforation is rare. For medical legal part, it's mainly used in the bleaching industry. Oxalic acid is used in bleaching. So it can be possible that there might be some accidental poison, right? Oxalates are naturally found in a plant called rhubarb. And if someone ingests that plant, accidentally obviously, they can get exposed to lethal amounts of oxalate. All right. It is usually taken for suicidal attempts, but homicide with oxalic acid is relatively rare because it has a very strong sour taste to it. So the victim would easily identify that he's being tricked to eat something bad. Okay, so that was for all for oxalic acid. Let's talk about carbolic acid now. So carbolic acid is also called phenol. All right. The only thing that I want you to visualize for carbolic acid would be something like Dettol or Lysol because it's mainly used for its antiseptic properties. Okay. The Dettol or those Lysols, the main ingredient in them is carbolic acid. Okay, so when you see carbolic acid in its pure form, it is colorless. It is like needle-like crystals, and when you try to taste them, it has a sweet burning taste and the characteristic phenolic smell. The smell that you get from Dettol is the smell of phenol. Okay, so there now carbolic acid does not have an acidic reaction. All right, it's not going to have those classic acidic reactions. But why are we classifying it as an acid? Because it forms salts with strong bases. Okay, so Let's talk about the signs and symptoms. Now, poisoning with carbolic acid is called carbolism. Okay? There are two actions, just say oxalic acid may take. One would be a local one, and the other one would be a remote one. Okay? The local one just would be some local signs of irritation, some ulceration, slight damage, the skin and the GI tract. And then comes the remote actions that are the main ones. So for local ones, skin, it has very high penetrating properties. Okay, so due to extensive penetration, the skin will show necrosis or sloughing of tissues. Now, I want you to remember that this carbolic acid has some anesthetic properties to it, meaning that it's going to slightly numb the area where it's applied. Okay. Now, why I'm emphasizing on this anesthetic part? Because um, owing to this anesthetic property, it's going to numb the GI lining and there won't be any vomiting in case of ingestion of carbolic acid. Remember how we talked about oxalic acid and any other irritant that we just ingest and our body just tries to get it out of the system by inducing peristalsis in the reverse direction? Remember? This is not going to happen with carbolic acid. Why? Because it has numbed the entire GI lining, right? So, as per the mouth, it's going to appear corroded and burned. There would be slightly burning areas that would be visible, and they would also be white and hardened. Okay, so let's talk about the remote actions. The only thing that happens is that the person gets into shock. Okay, and now what happens when someone's in shock? He's going to feel dizzy, the skin's going to be cold and clammy, pinpointed pupils, temperature would be below normal. Okay, then let's talk about death. Death would not be that much rapid. There would be some renal damage as it's nephrotoxic. Now, the classic sign for carbolic acid poisoning is a green urine, a dark, smoky green urine, and that's called carburia. All right. This is something that back in the previous days when we didn't know about carbolic acid poisoning, it was widely used as an antiseptic in hospitals. And when patients started secreting a dark green urine, that was a sign that, okay, we've used too much antiseptic on this patient and we shouldn't be using it anymore. Okay. So the green urine is mainly because of two components or metabolites of carbolic acid. These are pyrocatechol and hydroquinone. Okay, so this is the green urine that we can get with carbolic acid poisoning. Okay, so fatal dose. You don't need to remember this, but still 20 drops of pure phenol. Fatal period can be around 3 to 4 hours if not treated. So let's talk about the treatment. Similarly, with oxalic acid, the degree of corrosion is not severe, so you can use a stomach tube to wash the stomach. Now, as for oxalic acid, the main hero was calcium. Remember? Now here, the main hero is alcohol. Okay, alcohol somewhat counteracts the action of phenol. So we can use alcohol to actually nullify the actions of phenol, right? We can give it in a 10% solution, not a very concentrated one, only 10% solution, which is a very dilute solution to begin with. You can use alcohol to just clear away the phenol, okay? You can use something like milk or eggs, but we don't usually do that. That's not very helpful. Saline infusions with sodium bicarbs can also be used to alkalinize the urine and speed up the excretion. Okay. So for the surface burns, you can use soap and water to wash up the acid. For post-mortem appearance, now this is a lot of going on. You don't need to remember it. Just remember the whitish patches that you might see within the mouth, and mucous membranes would obviously be swollen. Now, this is not something that can lead you to a diagnosis because many acids would show similar signs. Okay, but the things that we have talked about would lead you to a diagnosis. For medical legal aspect, it's mainly used as an antiseptic or disinfectant. So it's rare for suicide or homicide, and it can sometimes be used to induce abortions. That's it. Thank you so much. I hope you learned something. If you guys have any questions, you can type it in the chat box. Anyone, any questions? Anything? So,
Excuse
I
me, madam.
guess. जी जी जी
Okay, I have allowed them on the chat. They can post their question.
अच्छा पहले चैट पे अलाउड नहीं थे Okay, so I guess you guys weren't allowed to type in the chat box, so you can now type it. If you guys have any questions, please feel free to.
If you want to ask, then they can raise their hand and I can.
Oh, okay. Anyone? Any questions? Okay, so I guess no one's having any questions so far. We can call it off, I guess.
I think we can wait a bit.
Wait a bit. अच्छा चले.
Okay, maybe.
Okay.
Time to type.
Sure. I can wait for you guys. You can think of any questions if you have, and feel free to ask them. मेरे ख्याल से आज किसी को कुछ भी नहीं पूछना है. इसको आई गेस हम बंद कर सकते हैं क्योंकि मेरे ख्याल से अब तक पूछ लेते हैं कोई भी अगर पूछना होता.
I think either lecture was too easy or too.
It's all right. चलें. So I guess you learned something and take care. Allah Hafiz. I'm going to stop the share now.